How is fibromyalgia connected to lupus, SLE, symptoms? Imagine living with constant pain and fatigue that can feel overwhelming. Many people wonder how conditions like fibromyalgia and lupus are related because their symptoms often look alike. While they are different illnesses, they share some common features that can make diagnosis tricky. Fibromyalgia is a long-term condition where the brain and nervous system process pain signals abnormally, leading to widespread tenderness and discomfort. Lupus, or systemic lupus erythematosus, is an autoimmune disease where the immune system mistakenly attacks the body's own tissues, causing inflammation that can affect the skin, joints, kidneys, and other organs. Both conditions can cause symptoms like persistent pain, fatigue, joint and muscle aches, headaches, and difficulty concentrating, often called brain fog. Because these symptoms overlap so much, doctors sometimes find it challenging to tell whether a patient has lupus, fibromyalgia, or both. In fact, studies show that about 22 to 30% of people with lupus also meet criteria for fibromyalgia. When both conditions are present, symptoms can become more intense and harder to manage, since lupus involves inflammation requiring immune-suppressing medications, while fibromyalgia focuses on reducing pain and improving function through different approaches. Sometimes, people with lupus experience symptoms such as joint pain, fatigue, or skin changes that are actually caused by fibromyalgia rather than active inflammation. For example, fibromyalgia can cause autonomic nervous system issues, known as dysautonomia, which can mimic lupus symptoms like skin rashes or joint swelling without any actual organ damage. This means that not all symptoms in lupus patients are due to inflammation, and some may be related to fibromyalgia or nervous system dysfunction. The core difference lies in their underlying causes. Lupus is driven by immune system malfunction, leading to inflammation and tissue damage. Fibromyalgia, on the other hand, is a disorder of pain processing without inflammation or immune involvement. Because of this, treatments differ greatly. Lupus management involves medications that suppress immune activity, while fibromyalgia treatment aims to calm the nervous system, reduce pain, and improve overall quality of life. Diagnosing these conditions can be complex. Doctors relying on blood tests like anti-nuclear antibodies to identify lupus and look for signs of organ involvement. Fibromyalgia diagnosis is based on clinical criteria, mainly widespread pain and related symptoms, without evidence of inflammation. Sometimes, a person with lupus might have persistent pain and fatigue even when their inflammation is under control, prompting doctors to evaluate for fibromyalgia as a separate but coexisting condition. Understanding the connection between fibromyalgia and lupus is important because it helps ensure accurate diagnosis and effective treatment. Recognizing that these conditions can overlap or coexist allows healthcare providers to tailor therapies appropriately. If someone with lupus continues to experience widespread pain and tiredness despite controlling inflammation, they might benefit from assessment for fibromyalgia. This way, they can receive targeted care that addresses all aspects of their health, improving their overall well-being. Always remember, individual experiences vary, so consulting healthcare professionals for personalized advice is essential.